somewhere. All right, good day. In continuation with our previous discussion, during our last lecture, I was able to give a brief anatomy and physiology of the human eye. We talk a lot about the human eye, and today we'll be discussing on one of the conditions that affect our eyes. But before then, let me briefly talk about the structures of the human eye. Just like we have said in our last lecture, we talk about the various structure we have according to the layers of the eye. We said we have the outer eye, the middle eye, and as well as the inner eye. We talk about the outer eye where we have structure like sclera and corneum. Sclera, we said it make 56th part of the outer eye layers, and we also said the corneum form 1/6. Then today, in between the corneum, we also said there is an aperture called pupil, where the light ray pass through our eye to the lens. Yes, the lens, in our last lecture, we said it is one of the structure within our eye that is crystalline in nature. When we say something is crystalline, that is said that structure can allow light ray to pass through it through the process we call accommodation, and where it enter into the inner layer retina for visualization. For the sake of today's lecture, I will dwell a lot about the lens because the organs, if the condition in question affects the eye lens. We mentioned so many conditions in our last lecture. So the topic I'll be discussing today, it is the one that affects the human lens directly. So this lens is one of the structure of the eye where just like I've said before, where the light ray pass through, and there is a situation whereby some people might have some issues where this lens will be clouded, or sometimes it might be opacified. And when this happens, it tend to result into condition we want to discuss today, we call cataract. So, how did this lens look like? When you look when you look at our lens, we say it is transparent, just like a mirror. Something that when you look at yourself, when somebody look at your eye, you can be seeing the person might be seeing himself within your eye. It is that lens that be able to give us that feature of you to be able to see yourself just like a mirror. So this lens, the structures of this lens, for the sake of the lecture we are going to be discussing, it is made up of two arrangement of muscles. We have that of circular and we have that of radiating muscle. Some people will say the muscles are arranged like a brick wall of the bicycle. So we have radiating muscles and we also have constricting or circular muscles that when light ray comes into the eye, the circular muscles constrict in order not to allow the light ray to go and damage our eye retinas, especially cone cell and rod cells. And that's why sometimes when you are moving or even in the night, when somebody flash you sharp light, you discover that your eye will immediately blink. So it is through the work of this radiating muscle and circular muscle. Sometimes when the light ray, when the radiating muscles dilate, it gives room for the light ray to pass through the eye to the innermost layer, which is the retina, for visualization. So before we discuss the condition proper, we need to examine some of the diagnostic procedure we use in assessing one eye, especially when somebody is having eye disorder. Just like in our last lecture, I mentioned so many conditions that might likely affect our eyes, which include things like cataract that I will be discussing today, glaucoma, eye cancer, we'll talk about measles, we'll talk about conjunctivitis, we'll talk about onchocerciasis, so many, even trachoma. We have different conditions that affect our eyes. So as time permits, we will be picking them one after the other. But before then, what are those diagnostic procedures we do to detect these abnormalities within our eye? It is very important when you go to any of the ophthalmic department, you discover that as a nurse, you need to understand those procedures that one might be one a patient must undergo before they are able to assess that yes, you are having cataract, you are having glaucoma, you are having conjunctivitis, you are having damage of one part of the eye structure or the other. And this is very important for us to take note of. Then, firstly, among the standard eye examinations we have so many of them, but I mentioned few of them here for better understanding. The first one, we have what we call visual acuity test. We have refractive test. We have visual field test. We have tonometry test. We have ophthalmoscopy test examination. We also have slit lamp eye examination. These are some of the diagnostic procedures we have, and each of this examination is carried out in daily basis within our healthcare center, especially our ophthalmic department in any of the general hospital. So we have the first one, which we call the visual acuity. It is one of the assessments done in order to check the correctiveness and accurateness of a patient's vision. It is done to ascertain, is the person seeing well? Are you seeing clearly? What you are seeing, is it real? Are you the type that you are seeing what is not real? Some, when you do this examination for us to know if really the person is seeing or perceiving things the way they are. And it measures how well the patient see from a distance by reading letters and numbers of different sizes on eye chart. This helps to detect changes in the vision. So in this kind of assessment or the diagnostic procedure, they will give you charts or elements for you to read while you stay away, like maybe in 6 meter distance. It is used to determine the smallest letters you can read as a standardized chart. We call it Snelling chart, which could be heard 20 feet or sometime in 6 meter away. They will place a Snelling chart 6 meter away for you to read. And when this examination is being carried out, you will be able to know either if somebody actually can read correctly or not, or accurately. And this is very important for us to do. It is part of routine examination that we are doing for patients that have eye problems who come to seek medical care in the ophthalmic department. So sometimes some people can be able to read correctly when the object is within the 6 meter. If you can be able to read correctly, you can be score 6/6. But if you cannot be able to read by 6 meter, if they take the object far above 6 meter, if you are able to read at that time, it means that you are having long sightedness, because you can read from far, but you cannot see from 6 meter, or you cannot see when the object is close to you. But a situation whereby you can also read from below 6 meter, but you cannot read from far. It is another challenge that happen to individuals every day. So it is very important for us to do these visual activities, for us to ascertain either if our eye can be able to read or see what the way things are exactly. So then we also have another test we do. We call it refractive test. It uses a device for photophore or refractive error in a patient vision. This one, it is also part of the test we do or assessment we do for individual eye, for you to be able to know if the patient eye is able to perceive things the way they are. It can be color. When some people begin to perceive white object like blue, or some will be seeing blue color like red, it means that the person is having problem from refractive issues, and we can actually do what we call refractive test for us to be able to detect when somebody is having those issues. We also have the one we call visual field test. A visual field test is an eye examination that can detect dysfunction in central and peripheral vision, which may be caused by various medical conditions like stroke, glaucoma, pituitary disease, brain tumors, and others neurological disease conditions. Yes, this one is one of the tests we do. This visual field test, just like I have just said, when we do it, they will be able to detect. They examine the eye, the central portion of the eye, as well as the peripheral aspect of the eye, for us to know, is there any damages from the optic nerve? Is there any damage from the central portion of the eye? If yes, what is the cause of the problem? And people that might likely suffer these dysfunctions, when somebody is having glaucoma, when the pressure, the hotness, the heat within your eye is below the normal range. We talk about those that have strokes. You see their mouth bent to one side, or the hands, one of the hand or the legs, they can not be able to raise their hand or their legs. All these kind of things, these are the things that can also actually be detected from this visual field test. Then some people have brain tumors. It can also be detected. Then we have another eye examination we call tonometry. This one is the procedure that eye care professionals do in order to measure or to determine the intraocular pressures. What do we mean by intraocular pressure? We are going to discuss a condition we call glaucoma, or some people who said in a layman they can say hypertension of the eye, because actually when we talk about pressure, when the pressure within your eye is above the normal range, one would tend to be having serious issue, especially those that come down with these conditions tend to have permanent damage within their eye. Most of the time, any damage occur because of this glaucoma or pressures, one can hardly regain their sight again, because any damage done, it can never be reversed. So the test we can actually do to measure this intraocular pressure, it is what we call tonometry, which mostly it is done for us to assess glaucoma, for us to know whether if somebody is having glaucoma. Of course, just like we have said that hypertension is a silent killer, so this glaucoma. When we come to discuss it, you get to understand. So many people are living with this condition and it's killing their vision silently and without even knowing. Because especially people of Nigerians, all what we value things that people can be seen, but we don't value our health. It is always good for every human being to go at least every 6 months to go and measure the pressure of their eyes for them to know either if the eye pressure is within the normal range or not. If you fail to do that, you can go blind at any time, especially those people that they engage a lot with their eye. Those especially people working in the ICT, their eye is always in computer 247. Those that they are always addicted to chatting in midnight, especially unlike before that people were doing to go. So many people come down with a lot of glaucoma because this actually sends so many people to become blind because of some people are chronic chatters. What do I mean by that? They are addicted. They can't do without chatting. They are always on light. So you need to visit hospital to go and measure the pressure of your eye if you don't have been elevated because of the too much usage on the screen. Then we also have what we call ophthalmoscopy. It is done through the use of the ophthalmoscope about 6 inches from the eye and 15 degrees to the right of the patient. So the ophthalmoscope, it is the instrument we use to visualize the eye structures. They will view through the use of the ophthalmoscope. They will view the eye, both all the eye structures. I have made mention of all the structure within our eye. If any of them is damaged, it is this instrument that will view it for us to know that yes, the problem is from outer eye, middle eye, inner eye. The problem is from corn cells, rod cell, iris bodies, ciliary muscles, lens, and conjunctivas, anterior chamber, posterior chamber, just like we have discussed all the structures of the human eye. Then we have the last examination, slit lamp. It is a specialized microscope with a bright light attached to it that your eye can slit lamp. It is a specialized microscope with a bright light attached to it that your eye the specialist used in order for them to assess if your eye is having one challenge or the other. And this one is also very common. We also use it in the ophthalmic department for also assessment of any damages. But this one, it is even advanced method of assessment of the eye. So these are some of the eye assessment or diagnostic procedures we do for us to know either if your eye is still functional, is still within the state of good health or not. So take your time, visit any of the ophthalmic department to go and do any of these procedures like visual acuity, refractive tests, visual field tests, tonometry, ophthalmoscopy, slit lamp. All these things, these are some of the commonest eye investigation you can actually go and do for you to know either if you're having one challenge or the other. Then, after we have understand all the eye diagnostic procedures or examinations, it is very important for us to also start picking these conditions one after the other so that we discuss them in detail so that we know If they said you're having this, you know what they mean. The first topic I'm going to pick for today is glaucoma. Sorry, we'll first of all pick cataract first. When we are done with cataract, then we'll go to glaucoma. Today, the cataract is the opacity or clouding of the crystalline structure of the lens. Just like I've told you before, in my first lecture, I said if you don't know anatomy, if we come to discuss MEDSURG, you keep on struggling. You keep on struggling a lot because there is no how you talk about MEDSURG without you understand the anatomy and physiology, the structures, without you have the knowledge of the structures and the functions of all these structures. If you don't have the knowledge, I'm sorry, you'll be left out because you're not going to get what the details, informations. So when we said cataract, we say this is the clouding of the crystalline, or you can say it is an opacity of the crystalline structure of the eye lens. I've said it before. I said the lens is more of like glass. It is that mirror of the eye. When you look at the next person, you see yourself moving around within the person's eye. Ability of you to be able to see yourself there, it is that lens, that mirror your eyes have, which is called lens. It is transparent. It allows the light ray to pass through it. It permits entrance of the light through your eyes. So when you are having this clouding, when you're having the opacity of this crystalline lens of the eye, it's just like when you stand at the wall, you cannot see what is behind the wall. Or if we say something is transparent, just like glass or windows, aluminum windows, if you look at through it, you'll be seeing the person outside the mirror. It means that is transparent. It can allow you to view what is outside. But when you want to look from the wall of the building, you cannot be able to see what is behind the wall. That is how, when they say it, your lens become opacified. It means there is that clouding, there is that coverage of the transparent, there is that coverage, or there is covering within the lens of your eye. And when there is that covering of proteinous substances within your eye lens, there is no how the light ray can pass through your eye. So, and that's why you see so many people, you see so many things growing within the lens. When you look at it physically, it can be visible. You see some growth. Some people, when you check their eye, you see this growth there. And for the purpose of this lecture, millions of people have become blind. Millions of people become blind because of this cataract. You see so many people that you see them begging in the street. Majority of them, about 60 to 70% of them, occur as a result of what we refer to as cataract. For so many people, they are ignorant of it. When they are coming down with this cataract, they don't bother to go for management. And this management of this condition, it doesn't have any much management, except the major management of it is through surgery. When time comes, we'll talk about the management. You would get to understand how the management of cataract is being done. Then, let's quickly look into what are the causes of this cataract. We have so many causes. Some causes could be congenital. Some could be trauma. Some could be through aging. Some could be through cigarette smokers, like some of my friends that are addicted. See, especially even ladies of nowadays, they are very good. They smoke a lot. You smoke, continue smoking, you'll be in trouble. Alcohol, addictos. Some, whenever they have pleasure, they go to party, they drink alcohols. Some will smoke. Some like some of my friends that are very good in taking Igbo, Zakami, marijuana, so many things. All these things, they have a lot of effect on your vision, and they can actually cause a lot of damages to your eye that can lead to this condition. We also have what we call radiations. Some of you also, just like I've said before, radiation could be sun radiations. It could be light, just like those that abuse their eye on screen all the time. You see them, you are always on screen and you don't put on eyeglasses. One day you just wake up, your eye will close. They have to lead you from one place to the other. And no any remedy. Once the vision die, no any magic. If you like, go to any babalao. The eye is one of the organs that cannot be transplanted. If you like, go to anywhere, go to sky. Nobody can transplant eye to you. We donate kidney. Heart can also be donated. Liver can be donated. But if you like, go to India, where magicians are. When your eye die, it die permanently. No any remedy that can be done, because the cells of your eye cannot be regenerated. Then we also have diabetes. It's also one of the causes. When you have sugar, too much sugar in your body system, you can develop what we call cataract as well. Then we also have what we call trauma. So some like all these people that fight wrestlings, when they blow you in your eye, it can damage your lens. And some of you that have sharp mouth, you want to go and fight with your husband, you are not strong. You from there, you can get glaucoma from there. They will blow you. They will beat the hell out of you. Like habitual criminals. When you steal, they will beat the hell out of you. They can blow your eye and get your what is it called? They can get your eye lens damaged through a lot of beating. Then we talk about congenital causes. This one, it is also very important. Some children are born with these conditions. How come? Some people come, you see they will deliver some children blindly. It is because during the process of delivery, sometimes we used to do what we call forceps delivery. In the process of maneuvering the baby from the uterus out, the instrument can go and mount pressure on the baby eye, and from there the eye can deform. Some other medical procedures can lead to all these things. Then we talk about aging. In fact, the condition of cataract is one of the major causes of aging is one of the major causes of cataract. And especially elderly individuals that live above 40 years, they are prone to develop this cataract. So that's why the more you age, the more you visit the hospital. If you are the type that you are getting aged, try to go for regular medical checkup, at least twice a year. If you are the type that have occupations that involve the usage of your eye all the time, don't forget to visit hospital for checkup, for you to know either if you're having one eye condition or the other, before you start struggling to see what is clear. See, some people, their eye will become red and they will never rest in the name of looking for money. When you sometimes you get the money, but the vision is gone. How are you going to enjoy the money? The money become useless because money without vision, it becomes beautiful nonsense. So everyone have to be very careful. When you are reading, it's also very important. Don't go and read in a bad lighting conditions, and don't read under too bright light conditions. When the light is too much, there is a problem. When the light is too low, there is still a problem. So you need to all address all these issues. All right, let me briefly talk about the sign and symptom before we call it a day. We have discussed a lot. Generally, what are those signs and symptoms? What are those things you see for you to know that, yes, I'm having cataract, or you are having cataract per se, not me? Because it's not possible for a tutor to be having cataract, because we are taking care of our eyes. We visit the hospital all the time for regular checkup. It is only on serious students and those that are ICT staff that are not doing the normal thing end up developing these conditions. So cataracts usually occur slowly. You might have it, but it occurs slowly. It doesn't pain you. It's painless. And that is one of the bad side of it. And majority of people that go to hospital, about 80% of patients that you see in the hospital, they report sick because they are feeling pain. And that is what is deceiving them. And that's why you see so many people moving in the street, become beggars, begging for what to eat because their eyes goes blind. Who knows? Some of them they are computer analysts before. Some of them they are computer engineers. Some